Well, we're present how we manage the extended value stream in cancer care in São José dos Campos during from 2018 up to date. Me and Elitania will show you how we created this project, but there's a lot of people that are also involved, and we named them here. Some of them of IOV, some from the City Healthcare Authority. Well, we started this project based on the IOV value strategy and our mission, that is to reduce the cancer burden among us all. So our plan is just to reduce cancer burden by improving the experience of care, the cost of cancer care, improving population health, and the way we do the work. We try to do that using PDCA as an A3. When we started the project with the City Healthcare Authority, we just not started with cancer. We started the project with the whole system. So we were trying to help them to solve the process and the flow that involved all specialties, because cancer is a multi-specialty disease, and there's a lot of specialties involved with that. So we put forces together in 2018 to improve the quality and the flow of the public health care system. At the same time, we started the Previna project. So they were in parallel all of the time, and we did some improvement in the whole system and some improvement specifically for cancer patients. But most of the time, both were all in benefit of the patient. The basic idea behind what we did was creating escalated daily management for the City Healthcare Authority, develop leadership and create leadership discipline with standard work for leaders, develop problem solving capability for everyone in the system, standardizing processes and standardizing routines and redesigning processes, most of the time thinking about make it visual, so using visual tools for the whole system. The city is quite big. It's more than 700,000 inhabitants and more than 50 primary care facilities and a lot of secondary care and tertiary care facilities. So the work to be done was that we needed a shared vision. We need to develop leadership behavior. We had some plans and some tracks to follow using what we learned from IOV. Actually, we were using cross-pollination to show them how we did it. And also it helped them to develop ways to sustain it. We did plans for short and long term, starting with 4 major projects. The Previna is one of them. And we created a way to navigate through the system and to check and adjust it. And the sample of it is this Obeya room that it was back in 2018. Now it evolved. It is now completely different. It's a different place now. But the way that we are weekly discussing how things are going and how the system is working throughout those 46 primary care facilities, 8 emergency rooms and 2 big hospitals with emergency and specialized care, and other non specialized care hospitals, but hospitals focused on cancer that I will show you later in this presentation. This is a sample of what happened with blood sampling in primary care units. So from a simple value stream redesign of the process, they were able to almost double their blood sampling capacity and to deliver results much faster. They use it to take like 1 week to deliver a blood test that was considered an emergency from a primary care unit. So patients would have to go anyway to emergency department. Now it's just 1 day. So if you have a patient that need a blood test and they are not really bad, if you can wait for 1 day, you collect a sample today and tomorrow we will have it. Before it was like 1 week. For routine blood sampling, it was like almost 4 months to get a result. Now they doubled capacity and improved the time to response much faster. Logistics, we did a lot of work with that. Actually, they had a lot of problem with their inventory and the way they were managing their goods in the primary care, in almost all primary care units. They had a lot of problem with drug expiration because they were not managing the way drugs were stored and were followed for quality. We did a lot of work. From the 46 facilities, we have now around 17 to 18 facilities that have been completely redesigned. They are delivering now. Before they had like monthly deliver supply chain for those facilities. Now they're delivering weekly for 17 units. And this is the 18th unit just last October. And the room that is now empty will become the Obeya room for this facility. All the drugs are now delivered throughout the pharmacy, and it is the point of use where the pharmacist delivers it to the patient, immediately to the patient. So there's much value added to patients, but also a lot of value added to the system. They saved a lot of millions of reals. Actually, they saved a lot of money, almost 90% of money saved in their supply chain delivery process, and a lot of saving in inventory as well. With the saved money, they were able to improve their capacity by 1%. And just increasing 1% capacity and redesigning the flow, they were able to improve access by more than 50% in some specialties. The way we did stuff in the work in this projects was very simple. A3 problem solving, thinking about a dedicated team, Gemba-based and data-based, creating daily management with Heijunka boards, daily and weekly huddles, and most of the time thinking about Q discipline, creating fast track, regular tracks, and special tracks. And I will show you some samples of that. And Elitania will present later how we did it with cancer patients using the same idea. So the Previna project now, cancer is the second leading cause of death in the city, and patients were facing long waiting time. So beside the high budget assigned to cancer care, the result was not good. Patient was waiting a lot of time, and we had low adherence to treatment because patients got sicker and got to hospital, and most patients got no appropriate care. So we had some specialties with waiting time access longer than 1 year. We had no dedicated access for cancer patients in a lot of specialties like urology, and no care pad at all for those patients. So what we did, we started redesigning the chemo facility to increase their capacity, started the Previna daily management that Elitania will show you how it works. We started with a pilot project redesigning the flow for prostate cancer. At the same time, creating the daily management for all cancer patients, but starting with just prostate cancer. Then redesigning the radiation oncology flow for support prostate cancer patients needing radiation treatment. And now we will just show what happened during the pandemic. So this is how we redesigned the public cancer center for chemo treatment. So now this unit is seeing more than 2,000 new patients a year, but it was not that way. And the rationale was the same. Q management with fast track, regular track, and special track with 4 product families. Those patients needed chemotherapy that was fast. I mean, that you made it in less than 1 hour. Patients that using chemotherapy that require more than 1 hour, chemo in oral chemotherapy, and chemo in patients just on follow-up. So 4 families, 3 lines for those patients, all new flows, more than 6 months of training, and they had to increase their personnel by 10%, including 1 pharmacist and 1 nurse, and a transition process. From 2017 to 2018, they more than doubled their capacity from 430 patients under treatment month to more than 900 patients under treatment month. And this is the current performance of this system that was able to support the needed access for the Previna project, as Elitânia will show you later. The same happened with the radiation oncology flow redesign, that we had to manage patients on the queue and created 4 product families, a little bit different from what happened from the chemo families, because we created a special flow for prostate cancer because it was related with our pilot project. So patients on the prostate fast and regular track had a special flow for them. Then we got breast cancer, and prostate and breast cancer represented more than 60% of all radiation oncology patients. 30% were all the others and emergencies. And we got a special flow for emergency patients that you see on these red dots on the right side, top right side. This is the Rei-Juncker board for all patients needing specialized care with radiation oncology, including radiation therapy for prostate, breast, and all other patients. So now I will pass for my colleague, Dr. Elitânia, and she will show you the rationale and what's happening with the Previna project. Elitânia?
Hello. First, I am very pleased to be here to present our work using lean tools, aiming to improve the treatment of cancer patients in our city. And the first pilot project was for prostate cancer. We redesigned this flow, and based on the rationale that patients aged between 50 and 79 years old with PSA over than 10 have 67% chance of being carrying a prostate cancer based on the literature data. Patients with elevated PSA had no special flow to access urologist and to get a prostate biopsy. That waiting time to access a neurologist was over than 180 days, and 100% of patients with PSA over than 10 should be biopsied if not contraindicated for other medical issues. Thus, the redesign was that patients considered high risk were assessed by a clinician and a biopsy was indicated. The patients considered low risk, this with PSA between 4 and 10, were evaluated by a neurologist in a special track. And from April 2019 to September 2020, 277 patients were biopsied in the fast track. For these patients, we had that 54% were positive for cancer, not as predicted by other studies, and 72% had aggressive prostate cancer. Okay, the other one. Okay. Since we start our project, we could see that the treatment up to 60 days, we improve more than 50% between 20 and 16 for 2020. And this was a very good result. And the other one, okay. The Previna project is grounded in 4 major actions. The first one is the process redesign. First, to better connect several different providers in several different organizations under an oncology supervision, my supervision. Daily problem solving for teams involved. Active surveillance of high-risk tests like PSA, mammogram, biopsies, colonoscopes, and PAP smears. and manage daily flow and prioritization using visual tools. Okay. The second one for these major actions is escalated daily management system. So we have daily catchball with primary, secondary, and tertiary care providers, weekly catchball with oncology care providers, and bi-weekly huddle for global performance with City Healthcare Authority for All. The third is an open communication channels, a hotline with the flow manager for 46 primary and other secondary care units, specialized decision support by phone with an oncologist, and strategy deployment. And for emergency access and flow, standardized emergency access routines. The Prevena results since 2018 to 2020 is that cancer diagnosis increased substantially, even during pandemic period. Access to care before 60 days of diagnosis almost doubled from 2017 to 2020. Flow improvement reduced time to access breast cancer immunohistochemistry from 38 days in 2018 to 4 days in 2020. And hotline answered more than 2,500 demands up to December 2020, coming from primary and secondary care providers to improve patient access and flow. The Prevena results between since 2018 to 2020. In this slide, we can show that the treatment start up to 60 days, improve more than 50% from 2016 to 2020. Prevena 2020. During the COVID-19 pandemic, we had our hospital, oncology hospital called PIL-12, was designated a COVID-free hospital. Since this, no COVID patient admission, elective surgery suspended only for 3 weeks during the initial phase of pandemic days, and we transfer COVID positive patients to other facilities. We had significant decrease in secondary care procedures, biopsies, CAT scans, and other procedures, and QE management to provide access to high-risk patients. We had in Brazil during pandemic a 77% reduction in cancer diagnosis. But in our city, with these tools, we had only 20% reduction in cancer diagnosis with the period of pandemic of COVID-19. Our challenges for the future are that COVID-19 pandemic reduced volume and access to care during quarantines and limited resources. Sustained improvement is dependent on leadership and teams' commitment to keep all elements combination active. The leadership, development, and discipline are crucial for a project like Prevena. And a cultural shift usually requires more than 5 years of stable process. Thank you.